Hello and welcome. My name is Amy Royer. I am the project coordinator of the Montana Rural Health Initiative. The mission of RHI is to engage partners to share ideas and expertise and to support communities in improving health while stimulating a higher level of wellness across the state. Thank you everyone for joining us here today for our webinar promoting SNAP for seniors in Montana. We have with us Minkie Medora and Elizabeth Weaver. And it should be a really interesting presentation. All right, without further ado, I will switch it over to Minkie and she can begin the presentation. So Minkie, I'm going to make you the presenter and then you will share your screen.
Okay,
All right, perfect.
right.
We can see it.
Okay, great. Well, welcome everyone and thank you for joining us. My name is Minkie Medora. I am a registered dietitian and I'm the consultant for state aging services. And we also have with us Elizabeth Weaver, who is the SNAP outreach coordinator at the Montana Food Bank Network. We're excited to talk to you all about this particular topic, not because you don't know what SNAP is. I'm very sure you're all very familiar with what SNAP is, but the impact of hunger on seniors in Montana, and that is slowly becoming a growing problem. In the last census data that came out, poverty did not go up for adults and children, but it went up for seniors. And when more seniors are poor, they're more likely to be hungry. So part of our hope in doing this webinar is to also hear from you, because we would like to know what experiences you've had with promoting SNAP among seniors, whether you are an information or a referral person or working at a senior meal site. We would very much like to hear what you have been able to do in order to promote seniors for registering in SNAP. And Elizabeth has excellent information on points you can use to help the seniors enroll in the program. So let me just start quickly with talking about the lack of quality of food when people are hungry and food insecure. Now, seniors can be hungry for other reasons, like not being able to get to the store or not being able to move around. But by and large, the main problem with hunger among seniors is lack of money to buy proper food. And when they don't have enough money to buy food, healthy food, things that have lower fat, lower salt, sugar, more fruits and vegetables, more whole grain, then the quality of their diet goes down. And in many cases, that impacts some of the diseases they're dealing with, chronic diseases like diabetes and high blood pressure. I mean, we all go to the grocery store, so we all know what the price of food is like. And it is cheaper to buy a higher fat pound of ground beef than it is to buy a lean pound of ground beef. Or things like fish, even frozen fish, are expensive by and large. I mean, we can say that seniors can eat beans to get protein, but let's face it, they can't eat beans frequently because they have trouble digesting them. So the point here is higher quality food, such as skim milk, lean meat, do cost more than the better quality foods. And research has shown that when seniors don't eat well, there are numerous problems that can happen that affect their bodies and their health. Things like increased depression, heart attack, asthma, congestive heart failure, cardiovascular disease, certain types of cancer, diabetes. And when this happens, their health goes down even further. For example, and I'm sure many of you deal with this, you must know seniors who used to be able to move around well, but they've started feeling increased weakness. Now, you know, we can say, well, that's because they're getting old. But in fact, not being able to have enough good protein in the diet causes muscle loss, and muscle loss causes weakness. The same is true for if they're not getting enough dairy in their diet and not getting enough calcium, and that leads to fragile bones, increased risk of falls. And then you folks who are dealing with information and assistance see the need for other things in their lives, such as help with transportation, help around the house, being able to go to the store, when in fact a lot of that could have been avoided if they had had a healthy diet. This slide is particularly important because it demonstrates what I'm saying, and this was done through extensive research by Feeding America. That's a national organization that deals with food insecurity, particularly among seniors. And as you can see, they are at greater risk than people who are healthy and eat well for heart attack, asthma, congestive heart failure, chest pain, daily activities of living, and coronary heart disease. And these are just a few of the examples of where seniors who are hungry, their health is impacted. So what happens when seniors eat a poor quality diet on a long-term basis? Well, more often than not, they're not following the guidelines for their particular disease problems like diabetes and high blood pressure or even certain cancers. As I said, muscle and bone loss is a real important and critical outcome of poor nutrition, and it creates other problems that are more costly to deal with. Seniors who don't eat well will have sudden weight gain or sudden weight loss, both of which are an indication of malnutrition. And that's because there are times when they can eat and they eat too much, and then there are times when they just go without because there isn't food in the house. There's the fear that they deal with, which causes mental and emotional stress. And one of the most expensive outcomes of a poor quality diet leading to malnutrition is further diseases and increased trips to the hospital, which cost not only the senior more, but their health programs. Just quickly, these are some of the ways that seniors who are poor try to deal with hunger. They buy cheap food, they skip meals, they water down their food or drink. Some of them are fortunate enough to receive help from family and friends, but that is not a consistent source of getting good nutrition. They also avoid going to the doctor or taking their medications on time or taking care of dental health. They avoid filling their prescriptions, and they have the hard choice of choosing between whether to buy food or pay rent or pay their utility bill or transportation or health care costs. So not only are they dealing with the increased stress of going without, but they are dealing with, trying to deal with the problem in ways that are only going to make their health worse. So with that brief introduction, I would like to introduce Elizabeth Weaver, who is going to give us a more positive side of this and information on how the very critical work that you're all doing can be enhanced in any way possible to increase the number of seniors you can help to get on the SNAP program. And at the end, Elizabeth has given her contact information so that you can reach her as and when you need to. Elizabeth?
Thank you, Minkie, and you can go ahead to the next slide. Yeah, so hopefully I'm going to do exactly what Minkie said and make it not doom and gloom, but try to arm you with some information and tools today that you can use, whether it's with your clients who are seniors or at the agencies you work for. But just a little bit about me and the Montana Food Bank Network. So as Minkie said, I am the SNAP Outreach Coordinator, but I'm not employed through DPHHS or the Office of Public Assistance. I'm employed at the Montana Food Bank Network. And just a little bit of background for those of you that aren't as familiar with us. We are the only statewide food bank in Montana. And we work our mission statement is to work to end hunger in Montana through food acquisition, distribution, education, and advocacy. So our primary focus that we do is food distribution to about 140 partner agencies across the state. These are your traditional food pantries. These are senior centers, soup kitchens. We do some boys and girls clubs, etc. We kind of act as are able to do wholesale purchase, and then smaller agencies are able to get the quantities of food that they distribute to their clients at a bulk rate. More so than they could do at Costco. So we kind of act as a wholesale distributor. And then the other programs that we focus a lot on are advocacy, education, and outreach around hunger and hunger issues. Montana Food Bank Network really believes that we know that hunger isn't going anywhere in our society, although we would like to work ourselves out of a job. We say that here all of the time. But we recognize that it's a complex issue, and that we have to take a look at it, at the laws that were being passed, at the policies that are in place, and at the education and outreach that we do to even just, your average citizens about programs that they can utilize, and also then to other citizens who might not be needing those services yet, but also how to change the stigmatisms and mentalities that sometimes surround low-income folks or asking or needing help from emergency food shelters. And Minkie, you can go ahead to the next slide. So I'm not going to spend a lot of time on this particular slide because a lot of this is information that I am sure you know. Right now we're living in a time when the baby boomer generation is aging into the retirement phase, and it's like 10,000 baby boomers a day turn 65. And from every day from now until about 2030. So that is causing, and because 65 is like the traditional time, quote-unquote traditional age that we talk about seniors, but now we're seeing it as low as like through AARP and SNAP, they qualify folks starting at 60 as a senior. So this number of growth, and this isn't just in Montana, although we are seeing a noticeable tick of in this age demographic in Montana, is happening nationwide. The other fact that I find kind of alarming that puts it into perspective is on the bottom of the screen that by 2025, seniors are projected to comprise more than 30% of over half of our counties. So the population of 42 Montana counties, and there's 56 of them, are going to have populations that are over 30% of which are seniors. And I actually think that I read a statistic recently, and I want to say that they projected that that's going to be closer to like 36 to 40%, but obviously it ebbs and flows. Yes, some of these counties are smaller, but a lot of these counties are very rural, which, again, as I'm preaching to the choir on, you all know, but also it makes kind of the importance of reaching these seniors even more critical. And Minkie, you can go ahead to the next slide. So SNAP can play a really great and important part in reaching seniors and making sure that they are food secure. In many of the counties that have aging populations and that are smaller, we at the Montana Food Bank Network do our best, but we have many counties across our vast state where we don't have partner agencies, or there are many communities where there aren't emergency food pantries or shelters or places for folks to go when they don't have food. SNAP kind of helps bridge a little bit of that gap, and as you know, it stands for the Supplemental Nutrition Assistance Program, and it really is our nation's most important anti-hunger program. It's federally funded and is kind of being debated right now on Capitol Hill in Washington, D.C., as we are entering a series of farm bill negotiations at the federal level. SNAP is firmly housed under the Farm Bill, and it's administered at a state level by the Department of Public Health and Human Services. One of the greatest things that a lot of the stigmatisms around SNAP have to come because it did used to be known as the food stamp program and operated in some ways vastly different than it does today. So a lot of folks, when you talk about SNAP, get a little confused look in their eye, and then they're like, wait, are you talking about food stamps? Or they'll say, that sounds a lot like food stamps. It is essentially the program that was birthed from food stamps and actually got a name change. It will have been known as SNAP 10 years in 2018. So in 2008, it became known as SNAP. So we're still trying to eradicate food stamps from people's vocabulary, so to speak. Minkie, you can go ahead to the next slide. So some quick SNAP facts. This is just about kind of showing the importance of how it's being utilized and what it can do. The average SNAP benefit for seniors in Montana is about $118 a month. This is in 2016, and the SNAP follows the federal fiscal year, so in October 1st, they released their new kind of eligibility guidelines and amounts. So these will change a little bit, but it's going to be on average about $118. And about 15% of elderly SNAP households received the minimum benefit, which was $16. So that left, 85% of seniors who are getting SNAP are getting more than that. And almost 10% of all the households in Montana that are on SNAP included one senior. That number we're seeing rise year to year. So it'll be very interesting in the next 5 years to see how much bigger that percentage gets. And SNAP does really great things for our economy and state. It brought in $171 million of revenue that it pumped into the economy just from folks using SNAP at their local grocery stores, which creates jobs, creates revenue that's given back to the community. And Minkie, you can go to the next slide. So one of the things, and Minkie kind of touched on this with the talking about food insecurity and what happens to you health-wise. Why SNAP? Well, as I mentioned, and as all of you know, when you live in rural areas, it's hard to get, access to food in general, and it's really hard sometimes to access other food pantries and things of that nature. But SNAP can help improve overall financial security. For seniors, this is a big deal. They're living on a very tight fixed income. With SNAP, it can help them free up money for other expenses that they might need, whether that's mortgage payments, whether that's land, like tax payments for their land that they live on, whether that's car, gas, medical expenses, things like that. And then SNAP, most importantly, provides the ability when groceries are very expensive to get that extra money that can go towards fresh fruits and vegetables or dietary restrictive foods. In today's day and age, we see a lot of folks that have gluten intolerances or allergies, peanut butter allergies. They have, they're looking for lower sodium or sugar-free. All of those foods, we know from experience, cost a little bit more and can be hard to access when you're living on such a tight budget. And SNAP can just provide a little bit of the means to help make that an easier purchase. And Minkie, you can go to the next slide. So one of the things that is kind of why we're focusing on seniors, aside from the just sheer number of folks that are moving into that demographic, is that the participation rates. So there was, in 2016, about 120,000 Montanans received SNAP. And that's kind of been an uptick as normal after the 2008 kind of recession. So we've seen higher numbers in like 2011 to 2014, and they've kind of tapered off, done exactly what they're supposed to because SNAP works and does that. It helps people in the lean times and then kind of weans them off. However, with seniors, we're not seeing the numbers rising in that category compared to what the census data and what the aging population would dictate. Only 33% of eligible seniors, and that's folks that are 60 or older in Montana, are enrolled in SNAP. So there is almost 3/4 of an likely eligible population that could apply and receive SNAP that haven't even enrolled. And the state average for their SNAP participation rate is about 75%. So that's very, very different, showing that, we have many reasons behind why we think this is. A lot of it has to do with, like we mentioned, seniors are living in really remote and rural places. They don't know about the program or that they're eligible to apply. There's a lot of misinformation or just lack of information in general. They don't live close to an office of public assistance, et cetera, and we'll get into that in just a moment. Minkie, can you advance to the next? Thank you. So not to put the, like the doom and gloom that we're doing a bad job in Montana, this is a map, and it's a couple years old because it does take these, it's compiled from a couple of data from like Feeding America and census data. And this actually, though, I've seen a more recent one, but haven't been able to find it online, but saw it in a webinar. This hasn't changed a ton in the last couple of years, but just to show you that nationally, this is a problem that everyone is experiencing. There's only a handful of dark blue states on this map, and dark blue means that those states are still only at 50% or more of likely eligible population is participating. So nationally, there's a lot of work we can be doing to increase our senior participation rate in SNAP. And Minkie, if you want to go to the next slide. And this one kind of shows you how that compares to quote unquote, they call it like regular SNAP participation or household SNAP participation with more families that are not just senior specific. The senior specific line is that light green one at the bottom, and the darker, I think that's supposed to be blue, is the other SNAP household at the top, showing you that again, like we're trying to find different ways to get them there, but senior participation rate is always about half of what it seems that the rest of the national average is. And Minkie, you can go ahead to the next slide. So one of the things that one of the reasons that we expect that it is harder for seniors to participate in is the comments that I receive are, I don't want to take benefits away from someone else who's out there who needs them more. Particularly, this plays into effect where a lot of seniors think that if they apply, they're going to take it away from a family or a child, and that family or child will go hungry or won't receive SNAP. There's a lot of still, and especially for seniors because they lived through pretty much the entire lifespan of food stamps, remembering it as a negative connotations that were surrounding food stamps and the welfare queen, the issues that the program had, and just kind of the stereotypes that are affiliated with it. It used to be a coupon-based program, and it was complex and clunky to work with. It used to be there sometimes it's like, well, if you are on food stamps, like, will you be able to, is that still going to cover all of your needs? Are you still going to be able to use a food pantry, et cetera? So here are a bunch of messages that I talk about, not just to seniors, but to everyone, but just like pro-SNAP messaging to kind of reframe the mentality. And for seniors, this is a big one. It is very hard because it's a demographic of folks that have worked really, really hard their whole lives, but you never can prepare for the future. I always tell folks that no one knew what this post-2008 world looked like. I mean, many folks, yes, I do believe that you worked hard. I do believe that you saved, but when the world kind of goes on its side and you have unexpected medical payments, you came in jeopardy of losing your home, health things arose, all of this stuff, and it wipes away your entire life savings. It's okay in that moment to be like, this program exists to help you eat. There's so very few programs that you can take advantage of that will meet you right where you are, that SNAP is a really important one. So I always like to say that there are enough SNAP benefits for everyone who qualifies. You're not going to take it away from someone else. Seniors, I say, you paid into the program because you have worked your whole life. It's a tax that they take out. So when you were working, you were paying into this with your taxes. You don't say no to Social Security, so it's like you should totally, feel free, it's fine. You're not becoming, a lot of seniors don't want to have that idea of being needy or relying on the system. It's like you're not relying on the system. You've actually contributed to this program, so you should participate in it if you need it. Now there's a debit card. There's no more coupons, and pretty much every county in Montana has at least one store that uses EBT. And there's some pilot programs going on now with Amazon and Walmart to try to do grocery delivery where they can use their EBT. They're not in Montana yet, but we're thinking that that is kind of a way that SNAP might be going. There are even some, I think right now only Ravalli County has it, but Meals on Wheels and other feeding sites, senior centers, are accepting EBT so that seniors who are doing a hot meal, and if there's a suggested cash donation or something, they can use their EBT card for some of those food programs and feel like they're contributing but also not taking away from their cash on hand. The bigger thing that I like to point out is that third from the bottom, that you don't have to fill out an application on your own or at and it should be OPA, sorry, a typo on my part, OPA office. I do application assistance over the phone, and we have a wonderful system right now in Montana that our application is actually online. So you can do it online, or you can call me. I'll do it over the phone. This is actually, I was at a conference this summer with several colleagues from across America and talking about our application process and how we help folks sign up. And not every state has a SNAP application that's online. In fact, some of the larger states, you'd be shocked, like California, they don't. Alaska, they don't. So when I mentioned something about it being online, and not only online, but our SNAP application is also tied into the TANF application, which is Temporary Assistance for Needy Families, which is for folks living at like 100% of the poverty level. It offers some immediate cash assistance. So it's tied into TANF and also Medicaid. And those are all, and SNAP, they're all in the same application online. And some of my colleagues from other states were just looking at me incredulously because this was like a novel idea. So Montana is quite technologically progressive. So I like to let seniors know that they can apply. It's a relatively easy application process, especially if they're doing it over the phone, because I get to talk to them and ask them a bunch of questions. And then the other important message that I really drive home, because I do get this one when folks call or I'm talking to them and they see me tabling and they'll come over and they'll say, I was on SNAP, but I was only getting $16 a month, so I thought, what's the point? And actually, Minkie, you can go to the next slide. And I always say, the minimum benefit of $16 a month, it really does add up. That's like a $16 coupon, and you wouldn't want to throw that away. For a senior, especially if they're living alone, that's like free bread and milk for a whole year, and you wouldn't want to just let that pass by. And then this infographic came out from one of our friends at the Center on Budget and Policy Priorities, I believe, and it just showed all of the items that you can buy for $16 a month and the balanced kind of nutrition value of that. And I like it a lot because I think that that's a big part of getting seniors to participate, is not focusing on the negative that it's only $16 a month, but doing the spin on that and saying even if you're just getting the minimum benefit, that can still buy you so much. And in the summertime, there's a lot of farmers markets, too, in Montana that are accepting. I think we're up to now 25 farmers markets across Montana that accept EBT. And a couple of those markets do double up bucks for seniors, or there are programs that will do coupons for the farmers market specifically for seniors. So that's another way that they can really get more bang for their buck and really increase vegetables and produce, which is what a lot of them are looking for. And Minkie, if you want to go to the next slide. I'm not going to spend a ton of time on this. Many of you are also in agencies where you're pretty much familiar with eligibility guidelines. Just a couple things to point out. The SNAP eligibility guidelines operate a little differently than the LIHEAP and so forth. SNAP income eligibility guidelines are up to 200% of the federal poverty line. And a couple of things that I always get questions about because it's not intuitive. So gross monthly income isn't necessarily pre-tax, or if their Social Security benefit, whatever the premium is. I always tell folks gross is what the amount that's coming in your checks or what the amount that's showing up in your bank account is. So if you're having Social Security payment, or you get some sort of pension, or you get a retirement check each month, or VA benefit, whatever that is, the gross amount is all of that income coming in combined. And then, so they can't exceed, based on the household size, the number of that in the gross monthly income limit. And then the net, what they do in SNAP is then they take all of that money you have coming in and they do deductions. Seniors are allowed to count their medical expenses, so if they have any out-of-pocket medical costs, this does include therapy animals. It does include things like hearing aids, prosthetics. They do count if there is gas mileage for doctor's visits, especially if there's, in Montana, that's wonderful considering that, you know, if you live in Powder River County and you have to be driving up to Miles City for medical care, you know, once a week or once a month, that can add up. So they do include things like that will count towards your medical costs. Your medical costs, rent, mortgage, and utilities all add up and are deducted from that gross monthly income to get you to that net monthly income. And that net monthly income is kind of what you need to meet in order to be approved for SNAP benefits. Next slide, Minkie. So this is just a screenshot of, like I said, it is kind of a novelty that we have an application that's online. Now I use it almost every day, so to me it's relatively easy. There's a couple of spots that are clunky, but overall it's a great site. It's relatively easy to navigate, and the most important thing is on the apply.mt.gov, I don't have the gross and net monthly income guidelines memorized. I get a lot of people that ask me that, and I was like, I don't know unless I'm looking at that chart. But on the apply.mt.gov website, up in the top right-hand corner where it says, am I eligible, that's like a pre-screen tool that anyone can go to, and you click on it, and it asks a series of about 6 questions to kind of gauge where a person fits in the financial spectrum of things. And then once you finish those questions, it pops back and it says, you're eligible to apply for, and then it'll either say SNAP or TANF or Medicaid or any combination of the 3, and then you can start an application. So that's a really handy tool to know about, just to, sometimes it's hard to find the income guidelines, and because we use 200%, a lot of states use 130, so even if you find federal poverty guidelines online for SNAP, ours sometimes are a little bit different. So it can be hard to just know right away, and I never like to just go by the math of numbers that I see. I like to have a couple of other questions, so that's a really handy tool to know about. And then if you want to go to the next slide, perfect. Oh, yep, so one of the reasons that we're bringing you all of this information, because we know that many of you, if not all of you, work with seniors or have clients who are seniors or come in contact with seniors. And our biggest, for me, and I say our, although I'm in the policy department, but I'm the only one person really doing SNAP outreach here, my biggest challenge is the vast size of Montana, knowing that seniors are harder to reach. I think with kids we see a higher participation rate of SNAP with families because kids go to the doctor all the time, or when their moms are pregnant, they're going to the doctor a lot. They are also then notified about WIC. When their kids start going to school, SNAP materials and talk of SNAP is often tied in with registering because it does affect their free and reduced price meals, et cetera, et cetera. So I think that families have a lot more interaction with the services that are in tandem with SNAP, or offices that also offer SNAP, or just generally more aware about SNAP. With seniors, this becomes increasingly difficult because they might not be utilizing those other services where you would hear about SNAP. So we are trying to let every senior know and be in those hard-to-reach places, knowing that they might only come in to an aging services office. They might only be going to their doctor every so often. Maybe it's at the grocery store. Maybe it's in whatever way we can find ways to promote or at least have information available. We're trying to do that. So some of the ways that we are looking to spread this effort, or ways that you can help, kind of a next step is providing outreach materials or just having them on hand at your different offices or agencies. I have senior-specific SNAP brochures that I'm happy to mail as many copies as anyone would want to your office for you to have. And then you can answer questions or refer them to me if you're not super comfortable answering some of the questions that seniors might ask. That pro-messaging that I was talking about earlier, is really one of the best things that you can kind of arm yourself with, and just when seniors, if you hear them mentioning SNAP or they ask about SNAP, kind of throwing in some of those small points. I always say, well, like even it all adds up. SNAP benefits roll over from month to month, so if you don't use them all one month, they'll be added to your tally for the next month, and anything like that that gets seniors thinking about it as oh yeah, I could benefit from this, and this could be really good, and I'm not going to be taking it away from anything else, is also super helpful. You can always refer seniors here to the Montana Food Bank Network for assistance. I do application assistance. I don't offer it in person. I do it over the phone. We have a hotline that is listed in all of the brochures that we send out for seniors to call, or anyone to call, actually. And they can ask me questions. They can see if they're eligible. If they are eligible, I'll do an application with them over the phone and get that submitted so that they don't have to worry about trying to do a paper application, trying to get to their nearest Office of Public Assistance, or trying to do it online, which many seniors, that's not really a feasible option anyway. And then the third thing that if you're interested or it could be viable is take a training, and which I do offer, and then you can actually offer application assistance at your site or office. I do a more extensive training on the online application, which I can do webinar style or in person, and just kind of walk you through the steps on how to help a senior fill out an application. It's not super complex, I swear. It seems very daunting, but once you do it a couple of times, it's not. And the great thing is the way it's set up, it kind of will auto take you to the next screens depending on your answers, whereas the paper application is very, very daunting. It's like 13 pages, so I try to direct people to do the online one, and I'm happy to train or even just answer questions about the online one that folks have. And my contact information there is there at the bottom, so you can reach out to me via email or give me a call on my direct line, on my desk line, and I'm happy to send you some brochures, give you more information about trainings, etc. And then before we start our question and answer time, because we wanted to leave enough time for that, we have a couple of polling questions that we're going to ask you. And then the first one is going to pop up on the, I think in the side on your chat box. But the first is, are you able to help low-income seniors fill out SNAP applications and submit them to the state? So it looks like a lot of you that are responding, over like half, are able to help fill out SNAP applications and are already doing so, so that's awesome. Great. And then I'm going to move to the next polling question, Amy.
Okay.
And then the next question that we have, kind of based on that, is, and Minkie, the next slide, in your present position, do you provide seniors with information about SNAP when providing them information about other assistance programs? I'm very excited that so many of you can provide and or do provide SNAP application assistance, or at least helping seniors with that part of the process. That is a huge barrier for anyone, actually, but for seniors especially, just because it can be very daunting. And unless you are familiar with the kind of questions or familiar with public assistance, it can be kind of hard to fill those out. In some more rural areas, I know that they still use the paper application a lot, and that is a really, really daunting process to go through. So just having a live person for someone to either A, help them fill it out when sometimes they might not have great eyesight or handwriting, or just sometimes the wording of the questions can be difficult to understand, so just having an extra person to clarify things with is huge. And it looks like also a lot of you are providing your seniors with information about SNAP, which is awesome. And for those of you that don't, please feel free, and if you'd like to, like I said, I have some brochures and flyers, so it's very minimal on your part, but if you want to have them on hand at the desk, or if you have a little resource corner anyways, I'm happy to provide them. Happy to provide them to you, and I will, I think that I'm going to go ahead and put my email in the chat box once again, just so that everyone has it, or you can give me a call and I'm happy to send them to you. And I think that's the last polling question that we have, and I think Minkie and Amy, we're going to open it up to see if folks had any questions. So in our last, 15 minutes or so, answer any questions that you might have.
And one thing I would like to say, this is Minkie again, is we know that you may be very familiar with everything that Elizabeth has said. We want to know what challenges you have faced if you're trying to help a senior. If you know there's a senior that's struggling with enough money for food but has not applied for SNAP, is it difficult for you to get to them, to convince them that they should look into this program? Because we're not doing what you're doing, and you have a better idea of what the problems might be.
Mm-hmm. I will go ahead before, while there are no questions right now, and just echo what Minkie said, and that is, I enjoy, well, enjoy is like a strong word, but it's important to me to hear feedback too from other agencies and resource providers and service providers about what challenges they're seeing on the ground. I know the challenges that I hear about and when I interact with clients directly, whether it's via phone or if I'm tabling, but sometimes I know in every area it's unique, and I do hear a lot too about one of the challenges is sometimes like wait times and getting calls back, and we're just always interested to hear what other things are coming up from the ground, whether it's, we can assume that this is a big challenge for everyone, and maybe in some areas of the state it's not. So I'm just echoing kind of Minkie's sentiments that we really do appreciate and hearing your feedback, and also what you're hearing in the locations that you're at.
And then we also have one comment. It says, my seniors often don't have their financial information available. So what would you recommend with that?
If they don't have their financial information available, and I'm assuming, Lisa, that you are referring to like when they come into your office or chatting with you about this, people get very like bogged down in the weeds with exact information. If it's about more or less the amount of their Social Security check, there's some things with the application that you can do a ballpark figure, because when it's processed by, this application is processed by a caseworker, OPA is going to be able to double check it in a heartbeat against the Social Security, website and information. So I tell folks, if they don't have if they can't quite remember the exact amount, if they can give you a ballpark figure. And if it's other things like financial information, like their banks and bank numbers, I don't even list that. If they have anything substantial in a bank account, I might try to give them, like over a couple $100 in a savings account. I'll again list that out to the best of the applicant's memory, and then also maybe the name of the bank, but I don't worry about addresses, routing numbers, because again, the caseworker will ask them for that if they need it, which technically Montana's not really doing resource checks right now unless you've been previously disqualified, so it's not always necessary information. So I tell folks that like you can get through an application and helping them get at least into that system so that they are at least able to be contacted by a caseworker with some pretty bare bones amount of information.
Okay, this is Lisa.
Hi.
That's kind of like the LEAP, just to fill it out and send it in and get it in. Well, then they get older letters from LEAP, from the public assistance. It confuses them, and often many of them don't want to give that information out, or they can't find it, or, I mean, I should just start a list of reasons why they don't want to do something.
Yeah, that is a harder, if they don't want to give it out, that's a bit of a harder obstacle, because I hear you exactly what you're saying. It's the same way with like their Social Security number, and that you can only prod so much, but you can't make them give out that information, and that is needed information. So I think if it's, that's why I always try to tell folks, and a lot of times if it's just like their Social Security checks that they're getting, and we're not talking about maybe assets they have in the bank or anything like that, which most of them, if they're not anything of substance, I try to just see if there's a way that they feel comfortable just being like, hey, this is how we help determine your benefits. But yeah, that is, if they don't want to give it out, that's a much harder obstacle to overcome that I haven't found always the best way, aside from trying to coax them. But if someone doesn't feel comfortable doing something, I can't make them, and I don't want to make them, do it at that rate. Doing something that they don't feel good about or that's going to further confuse them with paperwork.
It's the confusing with the paperwork that happens with many elderly.
Yeah.
Now, are the Office of Public Assistance, are the local offices not doing this anymore, or what's going on?
So the local offices, it depends on where you are. We have heard differing things, and also because I'm, like I said, we work with BPHHS, but I'm not employed by them, so I don't often have like on the ground information. But from when I've had to contact them, from my understanding is some offices, depending on if they have an available caseworker, will help folks if they walk through the door. There are several offices that have had downsizing of staff, and so you might go to an Office of Public Assistance and they will help you, but you might also have to sit and wait a while. So it's kind of all over the board, and that can be a little dicey sometimes with seniors if they're already kind of hesitant to do it, and then if you have to sit and wait, and depending on if you're getting a ride. So the local offices in many cases will do it, but wait times are unknown, and availability of a caseworker are unknown. So yeah, that's kind of and sometimes it's just like the distance from the senior's home to the local Office of Public Assistance, because they operate normal business hours, or a little bit of a drawback.
Yeah, and we're seeing, when we're doing open enrollment, we don't really have a lot of time to run through all of these other programs.
Yeah, no, I 100%, which is one of the reasons too why I am always happy to mail brochures, so that if you have, are helping with open enrollment, but you have a table that's by the door when seniors come in and want to have a stack of brochures available to just hand them that has my number on them, and a bunch of information about SNAP in general, because I often know that everyone is overworked already and overburdened with their caseloads, but just giving that information in their hands is sometimes like the biggest barrier, because I don't always see the seniors that might need SNAP the most.
A lot of my seniors got it, and they don't want that.
Okay. Yeah.
I'm trying to find a way to help them that'll work.
Yeah. I hear ya. It's I know that there have been, we've done some great strides, and I'm hoping that in moving forward, as far as like with providers, trying to get as many connected into like a one-stop application system, so it's less multi-step process, is something that I would like to see. However, I don't know what the reality of us getting there is and what that timeline looks like.
That would be the best thing right there,
Yeah.
because you inundate them with this program, QM, QI.
Yep. No, I hear you.
Then there's SNAP, and they're all looking at you like it's deer in the headlights.
Yeah.
Yeah, you're right. It is a complicated program, and it doesn't have to be, but it seems that way. And I'm quite sure they couldn't fill it out without your help or without Elizabeth helping them. I've entered my email address in the chat box, so if any of you all think of any other questions later, please feel free to send them, because we really value more what we hear from you than what we had to tell you. And anything that you can suggest to make the process easier would be very helpful to us. Thank you.
You're welcome.
All right, thank you, everyone. And please, like Minkie said, email any one of us for questions. So have a great rest of your day.
Thank you all. Thank you.